knew I wanted to be a healthcare provider when I was in college. I was looking at my options for after graduation and looking for something to marry my interest in science and helping people and medicine and what I wanted out of my life. And as I learned more about midwifery and about the perspective and how they took care of women and the education portion of it, that looked like something that I was really interested in. So then as I did more research, I figured out that was what I wanted to do. I would say my greatest strength as a healthcare provider is my enjoyment of teaching patients. I really like being able to have real conversations with them and teaching them about what's going on to help remove fear from situations that I deal with all the time, but I know that they don't deal with all the time. This is a life-changing thing for them. And so being able to just like sit next to them and put them at ease and give them real information and build that trust with them and be able to make a plan together, I feel like that's something I've gotten feedback that I do well. My favorite health tip for patients, I'd probably call more of a mental health tip for patients, is to encourage them that as they're, getting closer to having a baby and they're developing their birth plan, whether it's your first baby and you're trying to figure everything out, or if you've had a baby before and you've just not had the experience you wanted, to really try to come into it open-handed, because I feel like the more you try to fit your birth into a box, the less happy you're going to be with your experience. And I think moms tend to be the most at peace afterwards if they're open-handed and flexible and realizing that you can do everything the right way, but birth just doesn't always go the way you want. Advice that I would give to patients if they're looking for a new OB provider specifically is to not only look at your OB provider, but two things. One, look at their staff, talk to their nurse, because you're probably going to spend more time talking to the nurse than you do your OB provider, but also look at where they're delivering, because that's a huge component of ultimately you could have great prenatal visits, but then if your birth does not go well, that's going to be what you take away from your whole experience. And so really looking into the hospital, the C-section rate, who's your backup, those sorts of things, getting that information can really help give you a more well-rounded big picture answer for who you're looking for. Activities that I like doing outside of work when I'm not sleeping from post-call. I love traveling with my husband. We have dogs, so we enjoy doing stuff with them. We enjoy gardening, stuff around the house. I enjoy being involved at church and serving that way, so it keeps me busy.